Om Shri Gurubhyo Namaha, Shri Bhavani Shankaraya Namaha, Shri Matre Namaha. First and foremost, let us begin with the Sabha Prarambha Prarthana. Om Dakshinasya Samarambha Shankaracharya Madhyama Asmadacharya Paryanta Smarya Guru Parampara Shruti Smruti Purananam Alayam Karunalayam Namami Bhagavat Padam Shankaran Loka Shankaram Shankaram Shankaracharyam Keshavam Badarayanam Sutra Bhashya Krutav Vande Bhagavantau Punah Punah Ishvaro Gururatmeti Murti Bheda Vibhagine Vyomavad Vyapta Dehaya Dakshinamurtaye Namaha Parijnanashrama Shri Guru Shankara Parijnanashrama Shankara Sadguru Keshava Vamana Krishna Panduranga Ananda Parijnana Guru Sadyo Jata Shankara Sadguru Gurur Brahma Gurur Vishnu Gurur Devo Maheshwaraha Guru Sakshat Parabrahma Tasmai Shri Gurave Namaha Om Sahana Vavatu Sahana Bhunaktu Sahaviryam Karvavahai Tejasvinavadhitamastu ma vidvishavahai Om Shanti Shanti Shanti. A warm welcome to all the viewers to this second session in the series of Atma Balam. In these unprecedented times where we are facing challenges every single day and every day the situation is changing, our mental well-being is something that has to be taken care of. So today we will be having this session which is going to help us do exactly that. With this, I would like to invite Shri Krishnanand Hebdekar Ma'am to firstly tell us a little bit about Sayujam and then introduce Dr. Madhur Amembal Ma'am, who is the moderator for this session. Over to you, Krishnanand Ma'am.
Thank you, Mohit. Jai Shankar to everyone. Warm welcome and good evening. Good morning to Yamini, who is logged in from the US. Welcome to this online program under the Sayujam umbrella, part of the series of programs which we will be having till June 2022. So in a 15-month period, we are having a lot of programs, and this is the second online program that you are viewing. We bring to you today another aspect of the effects of lockdown. What with the restrictions on movement and socializing, and how to cope with it. I'm sure most of us are practicing the techniques and tools given by our Param Pujya Swamiji, including Ninad and meditation, and along with your daily japa, which helps to calm the mind and regain confidence. Today we have two young professionals, panelists with a lot of experience, speaking on mental health care during the pandemic. And talking to them will be Dr. Madhur Amembal Rao from Pune. Dr. Madhur Rao completed his MBBS from Kasturba College, Bangalore. He did his postgraduate in tropical medicine and from the London School of Hygiene and Tropical Medicine. Then he has served with all over the world with the Aga Khan Hospital, Kenya, with Bupa, which is a healthcare provider in the UK. And during this period, he also did his MBA from the University of Gloucestershire in the UK. He is presently the Senior Medical Administrator of KEM Hospital. Be speaking to our panelists. Over to Dr. Madhur Rao. Madhur, this.
Thank you very much, Krishnanand Ma'am, and Jai Shankar to everybody. As we have said, mental health care during the pandemic is an issue which is not talked about a lot by people. because unfortunately it seems to be somewhat of a taboo topic when it's discussed, especially in India, unlike in the West where people do talk about it more openly. There have been a number of issues in terms of mental health illness, and during the recent COVID pandemic, they found that 1 in 5 people who've had COVID have been affected by mental health illnesses. So what we have also discussed and we have talked about is the impact on other people who are within the family members who have got to cope with a patient who is COVID positive and admitted to hospital. In our second wave that we've had in India, and I'm specifying that only because it's probably somewhat different in the US, we've had entire families who have been admitted to hospitals. So that has had a big strain not only on their physical health, but on their emotional as well as on their financial health as well. And in addition to that, we've had the issue of the lockdown where it has impacted a whole range of people. So it's children who have not been able to go to school, parents who have had to stay at home and help with their online teaching program and with connectivity issues, which I just faced a few minutes ago. It's probably really difficult for them. Then it's people who have had or been forced to work from home. They've had to stay at home and work. So they're all at home, and those kind of effects that it has on a family, on the family dynamics. And then it's people who, during the lockdown, have unfortunately lost their jobs as well. So that has had a big impact on their mental health as well. And then we have the vulnerable group, that is the elderly, who have felt even more isolated during this lockdown because they've had issues where they have not been able to go out at all. There's no social interaction, and therefore it's affecting them as well. So to discuss all these issues, we are fortunate that we have two people who have experience in this field, Dr. Nishreen Saif from Pune and Dr. Yamini Bellare from the US. So I'd like to just formally introduce them. So if I can start off with Nishreen Saif. She holds a PhD and MA in clinical psychology from the University of Pune. She's also in private practice and is an affiliate of AXA ICAS in the UK. And she is a cognitive-based therapist working with adults using emotive behavior therapy and dialectical behavior therapy. So I'd like to welcome Dr. Nishreen and Dr. Yamini Bellare. She's done a PhD in counseling from counseling psychology from Ball University in USA. She is a licensed psychologist in the state of Indiana, and she is currently a clinical assistant professor in the Department of Psychology at Indiana University in Kokomo. She has also worked as a counselor and with adolescents and adults at the University Counseling Center and community mental health agencies. Welcome, Dr. Yamini. So if I could, I'd just like to start off with a set of questions, and what we will do is run through them. And then we've also got questions that have come to us from members of our community as well. So if I could start with Dr. Yamini first and ask her, when does one become aware of one's mental health, and how are we reacting to the pandemic?
I would like to start by thanking you all for the opportunity to be a part of this panel. I really appreciate our MUT's initiative to focus not only on physical and spiritual health, of course, but also on mental health. And that shows that we're becoming more aware about mental health issues in our community and country. Now, the pandemic has had a very negative impact on people around the world. We've seen a huge rise in the number of people who experience anxiety, depression, and a range of other psychological issues. Now, you're probably taking care of your physical health but it's also important to be aware of your mental health. Now, when your mind is in distress, it puts out a couple of signs, and we need to be aware of these signs because it's your mind's way of telling you that, hey, I'm not really feeling as good as I usually do. It's very similar to the signs that your body puts out. So, for example, if you're not feeling well, your body will start aching or you'll have a fever, etc. Your mental health works the same way. So look out for some signs and symptoms of that your mind is telling you that, I need some attention here. So some really common symptoms are feeling like you have a brain fog, you have a cloud around your head, you feel like you forget things easily, you're either sleeping too much or too less, your eating is out of whack. So you're either eating too much, eating too less. You're feeling really burnt out, which means that you don't feel enthusiastic about your work, or you feel frustrated, angry, and irritable most of the day. You might snap at people that are around you. And you might have a very hard time focusing and getting through your routine on a day-to-day basis. Um, so you might also feel really restless, or have negative thoughts where you think about the worst that could happen in the situation. So these are some signs that you need to be aware of. And what is important is to acknowledge these signs, right? What is happening is your mind is reacting to the pandemic. You're being bombarded by news all day. You're stuck in your house. Your routine has gone out of whack as well. So as a result, your mind is reacting to this crisis situation that we're in right now. So those are some of the ways that you can realize that you need to be more intentional about your mental health, and I'm hoping that we can answer that question of how can I be intentional about my mental health as we move along in this manner.
Thank you, Dr. Yamini. Dr. Nishreen, would you like to add anything?
Yeah. I think Dr. Yamini has done such a wonderful job of sort of setting the context about mental health and what the early signs are. I would just like to very briefly add to that response, just to kind of bring people onto the context of mental health. We all need to understand first that we are all kind of sailing on the same ocean, right? But all of our vehicles are different. So someone's in a raft with just one oar. Some of us are in ships. Some of us are in boats. Some of us are just using a float and hanging on for our lives. So recognizing that and understanding that each one of us is going to have a very different response, a mental health response to the pandemic, is extremely important. She has elaborated rather well on all the early signs and symptoms, but simple ways of how we can check in, right? Just bringing into awareness that I need to check in, being open-minded about mental health is the first step. So like she said earlier, the way we are checking in on our physical health, how do I feel today? How do I, what does my body or, what are my joints telling me today? It is also very, very important to have mental health check-ins. Simple ways of doing it is maintaining a journal, giving yourself a simple score on a day-to-day basis about how you feel, sharing notes with family and friends, having conversations about mental health. Sometimes we, underestimate the importance of simple questions of how are you and how am I today? So I think our mental health journey starts with simple questions, pointed questions, which bring the elephant in the room into focus and say, okay, how do I feel? And that's where I think this journey begins. Very simple indicators to become more self-aware about mental health is checking how am I feeling today versus how was I feeling earlier. So getting time into perspective. Checking in on functionality. How was I functioning in the last few weeks versus how am I functioning happening, now is another, perspective to have. And also one simple perspective to have is what is normal for me versus what is not normal for me. So, like we said, everyone has a different response. So checking in on what is normal versus not normal in perspective of time and in perspective of functionality could lead us on to be a lot more aware of our mental health. So I think I'd like to just end there. Thank you.
Thank you, Dr. Nishreen. We both obviously talked about the early signs, but can you just talk a little bit about stress reaction or burnout due to the lockdown? What are your thoughts on that?
Yeah. So our body will tell us that something's going on, and similarly, our mind will tell us what is going on. Very simple methods of checking whether you're having a burnout, you're having a stress reaction, whether everything is okay or not okay with your mental health, could be using simple tools other than feedback, conversations, journaling. There are lots of simple stress checklists available online. There's a plethora of information which takes you through, certain questionnaires, and a stress symptoms checklist is a very quick, easy tool for all of us to use. What we do need to do is we need to check in on how we are responding in a few verticals, so to speak, right? So you check in on what your body feels like. Are there any stress reactions in your body? You will typically find reactions like aches and pains. You will find, challenges with fatigue, energy levels. You may find challenges with maybe an irritable bowel, for example. You could check in with another vertical on how, what is my body saying psychologically, or what's my mind psychologically. So you may check in and see if you have certain symptoms that a lack of concentration, lack of focus, in a mind fog, an inability to make decisions quickly, and these may be some early symptoms or identification factors. You could also check in on the emotional vertical, and by that we mean how stable do I feel? Do I feel nervous? Do I feel anxious? Do I cry easily? And signs and symptoms like this would start giving us, key information on, what the signs and symptoms of early signs rather, and symptoms of burnout, depression, anxiety, etc. are. I'd also like to very often talk about the Johari window and how that is a very important tool to receive and give information about how you're feeling. And the key factor, in my opinion, when it comes to mental health is not only checking in for yourself, but also receiving feedback and giving feedback. So that's what I think is key in terms of early signs and check-ins.
Thank you, Dr. Nishreen. Dr. Yamini, would you like to add anything to that? Is there anything that you find is slightly different from the presentation that you would get in the United States?
Sure. Now, stress, like Dr. Saif mentioned, stress looks different in different people. And a lot of times, stress also manifests itself in physical form. So you might find yourself experiencing heart palpitations, sweating, shaking, shivering. Some people also experience panic attacks where you feel like I can't breathe. And this usually happens when your body is going into crisis. Now, we need to realize that stress has an adaptive function. We humans experience stress for a reason. It's our body's way of keeping us alive, right? If you think of our ancestors, they had to run away from lions and tigers to keep themselves alive, right? However, right now, our body responds like we're being chased by a lion or tiger when you get an email from your boss, or when you're late for something, or when something goes wrong in the home, right? So it's the first step of stress management is to acknowledge that stress is necessarily not a bad thing. However, when we experience it for very long, sustained periods of time, it can have a very negative impact on our heart, on our blood pressure, sugar levels, all kinds of things. Another thing is stress also suppresses your immune system. So if there are any students out there, you've probably experienced that you're more likely to fall sick around exam time, right? Or if you have a major project coming up, your body starts feeling sick, or you have a cold or something like that, it's because stress suppresses your immune system, right? So stress management is a very important part of our day-to-day lives. And I think a lot of times we tend to wait for weekends to relax, right? We wait for our Sunday to show up in order to do stuff that is relaxing. However, what is important is doing some sort of stress management every single day. It doesn't have to be a facial, it doesn't have to be something really big. It can be something that is manageable, something that takes 5 to 10 minutes, anything that gives you joy. So let me give you an analogy. Your pressure cooker, when it comes to full pressure, you have to let the steam off, nor your pressure cooker is probably going to burst. Your body works the same way. Let out steam on a day-to-day basis. Build in times in your routine when you switch off from technology, when you switch off from watching, the news or reading the newspaper, and just do something that allows you to be more present with your loved ones, more present with your children, more present with yourself, right? So that's kind of what I want to add about stress management is that don't make it bigger and unmanageable. Add it, make it very simple, manageable, and put it in your day-to-day routine. That will be most helpful for you in these times.
Thank you very much. Both of you really explained that in terms that everybody can understand. So, Dr. Yamini, can I then ask you? We've talked about work-life balance and maintaining that kind of thing, but at the moment, because of the lockdowns in various parts, that isn't really possible because people are being forced to work from home. So, how do you maintain that work-life balance in a situation like this?
Sure. One of the biggest challenges that we've faced during this pandemic is working from home. Now, initially, it was a new experience. I didn't have to go use the train or the bus or travel hours to go to work. Amazing, right? But now that we've been in a lockdown for almost on and off for a year and a half now, things are getting, like you want a change, right? Now, so when you go to work, right, you're leaving your home and you're going to work physically, and that kind of creates a separation between your work life and your home life. Now, because of the lockdown that is happening right now, the boundaries between your work and home life have kind of become blurred. And around the world, what we are noticing is that people actually spend more hours working when they work from home. So you find yourself checking your email on weekends. You find yourself working after your 5 o'clock, the 5 p.m. time has come and gone. You find yourself thinking about work a lot more because you're essentially living in your workplace, right? So it's very essential to be very mindful and very intentional about creating a work-life balance. So how do I do that? The first and foremost thing is create a routine. So tell yourself, I'm going to work from 9 to 5, and then build in breaks for yourself in the middle, right? So set a timer and tell yourself, I'm going to take a break for 10 minutes. So I'm going to go eat something, or I'm just going to, take a walk around my apartment, or I'm going to stretch, do something that's not work. So build in these times during your workday when you can take that breather. It could also be very simple. You don't have to leave your apartment either. It could be leave the place where you work, right? Your desk or your room. Go and stretch. Take a few deep breaths. Listen to your favorite song, something that kind of breaks the monotony of work for you. So simple breaks works really well. My other advice is create a workspace for yourself. Avoid sitting on your bed while working. Why do I say that? Because if you are doing something very stressful in a place where you need really good sleep, your mind automatically starts associating your bed to work. So when you start, getting ready for bedtime and you go to bed, your mind reminds you, oh, I didn't read this email. Oh, I need to do these things tomorrow, because now your bed has become a place of work. You want to avoid that. So find a dining table, find a desk, find a corner in your home and make it your workplace. Okay. And tell yourself, the only time I'm at work is when I'm in that corner, right? So avoid working out of places where you need to be relaxing. Also, plug, get away from your computer and phone, your work phone, after a certain deadline. So if I tell myself I'm just going to work till 6 o'clock and that's going to be it, follow that. Okay. Do something else. Do something else that gives you joy. Now, burnout and work-life balance goes out of whack when you start using your leisure or relaxation time as work time. Because then you're working all the time, you're setting yourself up for a burnout. So set up a time when you're plugging off, okay, away from screens, away from your work laptop. Those things are going to help you create more boundaries between your work life and your home life. So those are some of the things that I usually suggest for a better work-life balance.
Thank you, Dr. Yamini. Dr. Nishreen, would you like to add anything to that?
I think a lot of ground has been covered. I'd just like to highlight one or two simple pointers in addition to what Dr. Yamini has already said. Like she mentioned briefly, our brain works on cues. And when there is a work from home situation, a lot of these cues are missing. So the journey to work, getting dressed, bathing on time, simple things like interacting with a different set of people is what the brain associates with normalcy. And therefore, in the work from home situation, a lot of normal cues, so to speak, are missing from our lives. And one of the ways of adapting and managing this phase of our lives well and not allowing it to impact our mental health, one of the methods we are going to have to draw from is finding those cues rather artificially and temporarily till this pandemic passes. So using all the methods that she has elaborated will definitely help. Yeah. Another thing to keep in mind is also recognizing a cognitive error, so to speak, about work before the pandemic, working from home during the pandemic. We are very often making a mistake of believing or making an error in believing that this is what life is now going to be like. Right? This is forever. This is a catastrophe. This is never going to pass. And that sets in a sense of hopelessness. If we were to just simply remember that life and mental health is about adaptation and our ability to adapt to change, and this is a change I need to adapt to. I need to do my best to be resilient through this, optimistic through this. This shall also pass, like many other pandemics have passed in the future. I think we will then start setting the right tone to deal with it in a healthy manner.
Thank you. Just on the back of that, I was wondering if you could just talk about family dynamics and how that has been affected during this work from home life, because you've had the children who are busy with their schooling, online classes. You've got probably both parents who work, who are now at home and have to deal with not only the child, but to work also on their different laptops. And so, one possibly, like Dr. Yamini said, is sitting on the bed and one sitting at the desk so that they are away from each other. So how do you think that has affected family life and family dynamics?
I don't think there is any one answer that fits all, honestly, Dr. Madhur. I think every family, every individual, every dynamic is unique. And just like the story goes of where, you boil three different, items in a pot of boiling water. In one, you drop a carrot, in the other, you drop an egg, and in the third, you drop some coffee beans. And you boil them all for the equal amount of time, but the outcomes are going to be very, very different. So I'm sure Dr. Yamini would be able to also agree with the fact that every client or every patient or every individual or family we are interacting with have very varied reactions. Some marriages are actually breaking due to the pandemic, but some couples are bonding beautifully because of the marriage. Some children are rediscovering what their parents are like, versus some children are seeing the real anger issues that exist in a parent or in both parents. So it's very, very dynamic, just like all situations are. And it's really up to us as individuals to, introspect and see how these dynamics are showing up in our children and in our family members around us. And I think one of the biggest opportunities the pandemic has provided all of us is more time and an opportunity to communicate. And if we were able to just communicate and understand, what we're seeing in one another more openly, I think a lot of information, a plethora of information will open up.
Dr. Yamini, anything that you feel is different in terms of what is happening?
Sure. To add to what Dr. Nishreen mentioned, communication is very important. We sometimes, as humans, we assume that our spouse or people around us can read our minds, right? They can tell. They need to figure out or guess what I'm feeling in the moment or what I want in the moment, and we usually get annoyed or frustrated when they don't react in the same way as we were expecting them to. So we kind of need to encourage people to stop assuming that others can intuitively guess what I need or want. Communication is important. The other aspect that's very important is compassion. This kind of goes back to Dr. Nishreen's point about we're all in the same ocean, in the same storm, but in a different kind of boat, right? So we need to be compassionate about how our children are reacting to the pandemic, how our spouses are reacting, how the elderly in the home are reacting to the pandemic. So be compassionate, be kind not only to yourself, but also to the people around you. Because one of the things that burnout does is it makes us snap at other people, get frustrated or angry very easily. Even if you were a relatively calm person before, burnout can make you more irritable. So being more patient with yourself. If I feel that I'm getting angry with the people around me, you need to take a timeout. Okay, a timeout is spend some time alone, start from 100 and count back as much as you want. And once you feel more centered, come back and continue the communication. Because anger doesn't take us anywhere, right? We just want to yell over each other and then the communication is lost. So if you're feeling angry, if you're feeling out of control, take a break, come back, start again. So being compassionate, being empathic as well, putting yourself in someone else's shoes for a change, and understanding, I wonder what they are feeling in the moment, kind of gives us a better understanding of the people around us. But the pandemic has been both a curse and a gift for a lot of people, and it's we need to acknowledge that as well. And I agree with Dr. Nishreen. It's really hard to give a blanket answer to this, but I hope people can take this lockdown as an opportunity for self-discovery and also self-improvement. Yes. Yeah.
Thank you. Dr. Nishreen, when should one seek professional advice or help?
I think that's the most critical question, Dr. Madhur. It depends on perspective, right? Earlier, the medical approach used to be go to the doctor only when you cannot tolerate the pain anymore. And similarly, more so for mental health, usually the response is very, very reactionary. rather than being proactive. And as a result of which we see mental health edging very, very close to becoming a world crisis, right? According to the Lancet study in Jan 2021, already pre-COVID, 1 out of 7 people in India was having mental health disorders. And the studies are underway, and I'm sure the gap is going to reduce further and further. So coming to your question, when does one seek help? I would say the earlier, the better. The more we move toward mental health in approach, in perspective, as something that we need to be careful about and maintain rather than treat and manage, then we are going to see a lot of things which are avoidable, especially in the cases with our young children, with our teens, with our young adults, and of course, every population thereon. Very often, a lot of mental health problems are avoidable if treatment is sought early. Now, you should reach out for help when you see that a lot of the symptoms or the signs that you're seeing, which are different from before, tend to stick. They tend to persist. Okay, they tend to usually persist more than 4 to 6 weeks. Is the usual rule of thumb. Obviously, personal, judgment is advised. You also seek help usually when functionality gets affected. That means you could go to work, you could put in your assignments on time, you could meet your deadlines, but you cannot do that. And this problem doesn't seem to be going away, right? 3, when it starts causing distress to people around you. So very often mental health problems may not cause a challenge for the individual in themselves as much as it's causing problems for their family members or caregivers or loved ones. So these are usual early, indicators that you do need to seek help. And as I can't emphasize enough, the earlier you seek help, the better. When we seek help, it does not necessarily mean we are going to go into a healthcare facility or a hospital or a doctor who's going to prescribe you a whole set of medications. It could simply mean reaching out to a helpline, talking to a counselor, talking to a family friend, maybe with some good skills, who would maybe edge you along and, point you in the right direction. That's what we mean by seeking help. If Dr. Yamini can add on that.
Yeah, Dr. Yamini, you.
I totally agree with the points made. A lot of times we usually wait until there is a crisis in order to get help. But the thing is, even before you hit crisis mode, there are signs and symptoms. I usually compare it to a storm. When a storm is coming, it doesn't suddenly start raining and, there are signs, right? The wind picks up, it gets darker, it's coming. Mental health works the same way. Your body and your mind put up signs telling you that you need help. Now, the context in the US is very different because people here go to a counselor like going to a dentist, like it's routine, right? And we usually tell people that you don't really have to have a full-blown mental health disorder in order to see a counselor, right? If you're having issues with communication, relationships, negative thinking, burnout, etc., even those could be reasons for going and talking to a counselor. Now, the benefit here is you're getting to talk to this completely neutral third-party individual who has no biases or no preconceived notions about you or your background, right? So as a counselor, I can be very objective in giving you feedback, helping a person with developing coping skills and a range of other things. And now, because of the pandemic, you don't really have to go to an office, right? You can do it on, over the phone. There are some text helplines as well if you are an adolescent, and texting is your mode of communication. There are also video phone, like video Zoom kind of conversations that you can have with a counselor. And like Dr. Nishreen mentioned, seeking help doesn't mean I'll be medicated. Seeking help doesn't mean that there is something wrong with you. It means that you are acknowledging that you're struggling and you want to kind of improve your life for the better. It doesn't. It's not a character flaw to seek help, and it's not. It's not something that is going to be permanent. Now, I also want to add that all of the disorders that we talk about are simply extreme versions of extremely normal emotions, right? So, if we feel sad as humans, right? Sadness is a part of life. But when that sadness persists and becomes really deep and you're unable to, you feel like you're in a pit at all times, then now that sadness has turned into depression. Now you might need some sort of help, right? Even if you have to take medication, you're not stuck to the medication for the rest of your life. When you feel ready, you can talk to your doctor or your provider and they can help you wean off the medication, right? So it's ultimately your decision how you want to seek help. However, it doesn't cause any harm to kind of call a counselor or talk to a professional when you need it, right?
Thank you. I just wanted to ask Dr. Nishreen, obviously Dr. Yamini has spoken about people in the US going to a psychologist or going to a counselor as easy as going to a dentist. And that's not necessarily the case here in India, because there is that reluctance and slight taboo about even seeking help from a psychiatrist or psychologist. How would you overcome that in a setting like ours?
Yeah, yeah. Actually, the picture has changed rapidly and dramatically over the last 2 decades that I have been in practice. In fact, Dr. Parlikar is right here on this audience listening in, and I'm sure he would also be able to confirm the fact that when I graduated in 2002, there would hardly be any patients willing to talk to a counselor. They would only arrive when they needed a psychiatrist, if at all, and that would only be because it was a very severe mental disorder. I barely had any people talking to me. I would have to time and again explain who I was and what my role was and what a counselor really did and why my role was important. And you fast forward to 2021, and not only me, all mental health professionals today in the larger cities and also the 2-tier, 3-tier cities we're all overbooked, and people have rapidly started recognizing the importance of mental health, and we're not very far behind, so to speak, from the Western countries today. And I'm happy to say that huge contribution of the government in spreading awareness, huge contribution of the medical fraternity, the psychiatric community for spreading awareness about mental health and conversations around it. I think everyone as a community, as a people have come together and it's no longer as much taboo. So I don't feel it's very different. Of course, I speak from an urban context of somebody who's really working with maybe a population that doesn't have as much stigma, but I do believe that things are changing in India as well.
Thank you for that. It's very heartening to hear that things have changed and people are seeking help early enough. Dr. Yamini, would you be able to explain some common signs of anxiety, psychotic problems, and depression? I think you probably covered a bit of it in your early signs, but anything else that you wanted to say? Yeah.
I think with depression, a lot of times you'll find yourself either sleeping too much, too less, your eating becomes too much or too less. There might be weight loss, weight gain. So those are some of the physical symptoms of depression. And from a diagnostic perspective, depression is extreme levels of sadness or an inability to feel pleasure or joy in activities that you used to enjoy before. And this usually lasts for about 2 weeks. In extremely severe cases, you might have thoughts of hurting or harming yourself. That's also a part of depression. But a suicidal crisis can also be a part of other mental health issues as well. So those are some of the signs of depression. And depression can also happen in children, and children usually show depression in different ways. Now, the signs that I described previously, those are adult signs, but for children, they might show a lot more irritability, a lot more tantruming, a lot more kind of fussiness with food. They might end up bursting in tears pretty randomly. They might be really clingy towards their parents or caregivers as well, might experience separation related issues. So they might not allow, mom or dad to leave the house because they're so anxious that they won't come back. So for children, depression and anxiety looks different than in adults. So, look out for those signs as well. Another sign of depression could be wanting to be alone. Leave me alone. I want to stay isolated, and kind of ruminating on different issues. So thinking the worst about things, or ruminating is essentially chewing on the same issue over and over and over again, feeling hopeless, helpless. Those are all the symptoms of depression. With anxiety, actually, depression and anxiety are two sides of the same coin. So, if depression is about your past, anxiety is about your future, right? So, you kind of worry about what is going to happen, when is this lockdown going to end, how is my job going to be like? If you don't have a job, you might say things like, "I'm never going to end up getting a job." So sometimes we tend to predict things in ways that are usually catastrophes, like the worst thing's going to happen, and that's a part of anxiety, and that usually goes along with the racing heart, sweating, shaking, shivering, panic attacks, stuff like that. And finally, psychotic problems. Now, the term psychosis itself means losing touch with reality. So it could be kind of hearing voices. It could be seeing things that aren't present. It could be a range of symptoms where you feel like you've lost a lot of time, like you've zoned out for a period of time. You're not in touch with the present, right? So again, I would like to highlight what Dr. Nishreen said. Even depression, anxiety, and psychosis could look different in different people, right? So there's no prototype that everyone experiences, but you might have different versions of the same thing. So it's very important to kind of be aware of yourself and look out for the signs and symptoms.
Thank you. Dr. Nishreen?
I won't go into the description. She's done a wonderful job. Just one highlight that I would like to bring is to the high functioning mental health concerns. So high functioning masked depressions, high functioning, anxiety disorders, high functioning psychosis conditions as well. They are people like you and me. They're around us. They're parts of our family. And because they're very intelligent, they're very productive members of society, two things happen. One, they don't let people in on what is happening to them very early. And two, they are resistant to seeking help because of the mental makeup of, it's not interfering with my functioning. And there is a lot of research now indicating that what we do see in our clinics or at psychiatric OPDs are only the extreme cases of the spectrum, and therefore it is very complicated treating these conditions early. So just being aware of that is something I just wanted to draw everyone's attention to. Being high functioning and being having a masked depression doesn't make it go away. It still needs help, and that's what we need to be aware of.
Thank you. Dr. Nishreen, if I could then ask you, what is the difference between positive coping methods and negative coping methods, especially during the lockdown?
Yes. So coping in general is defined as our ability to manage any kind of stress, any kind of crisis. Now, we always have choices, and those choices then define how you will recover, how you will manage, and how much of the condition will then relapse in the future. And I think that is where the differentiator between positive and coping mechanisms come in. Now, anything that falls under the vertical of positive coping mechanisms would have to do with help seeking, would have to do with reaching out to others for support, exercising, using mindfulness-based techniques, being a rational thinker, learning rational thinking techniques, being open-minded as an approach to your condition and to your mental health as well as physical health, of course. When we look at the negative ways of coping, what we will see is when people are trying to deal with their stress or their mental health conditions, they will use methods which may help them in the short term, but aren't necessarily good for them in the long term, and actually sabotages their chances of getting better. So using substances, avoiding and withdrawing from social situations, or denying help, saying I will not speak with a counselor, with a doctor, being close-minded about it, indulging in self-harm repeatedly without trying techniques that are available to, help yourself, would come into this, this vertical of coping negatively. If Dr. Yamini may want to add to that.
Sure. Like Dr. Nishreen mentioned, there are two main categories. There's approach coping, where you approach the problem, you acknowledge that there is an issue, and then you put in some sort of techniques or methods to deal with the problem, right? So that's approach, and that's usually positive because you're not running away from the issue, you're facing it head on. Now, approach coping is not just problem solving, because there are some issues that we experience that can't really be solved as such. But we need to learn how to deal with the negative effects or the outcomes of that issue that we're experiencing. So that kind of goes back to what was already mentioned, talking to someone, journaling, focusing on how to think about more rationally, changing your perspective about the issue. That also is a part of approach coping, where you are identifying that there is an issue and then identifying ways that you can address that issue. Now, on the flip end, you have avoidance coping. So I always think of like an ostrich. When there's a crisis, an ostrich kind of sticks its head into the sand, and it thinks that if I can't see danger, then danger doesn't exist anymore. That's avoidance coping, right? So trying to distract yourself or engaging in excessive social media interactions, or substance use, of course, and those are some of the kind of problematic ways of coping. Now, again, I'd like to highlight that within normal limits, some sort of distraction is good, right? But if you're finding distractions to run away from your issues, now we have a problem, right? So being aware that there are different styles of coping, there are different strategies of coping. My usual advice to people is think of coping as a toolbox, right? You have different tools in your toolbox, and different strategies can be used for different situations. Now, you can't use a hammer to fix everything in your house, right? You'll end up breaking stuff. So you need to have a range of coping strategies in your toolbox in order to respond to different situations. I'm hoping that we can add to your toolbox today. I know Dr. Nishreen has some strategies to share. I do too. So that's kind of our goal, hopefully, in the next few minutes.
Thank you, Dr. Yamini. Dr. Yamini, could you just tell us why the pandemic, in your opinion, has affected mental health like never before?
And this is worldwide, right? Even in the US, we're seeing more child abuse, we're seeing more substance use, we're seeing more divorces, family issues, relationship problems. Now, something like this hasn't happened in a century or so in our world, right? Where every single country has been affected. We've lost people that are really close to us. So we're dealing with an unprecedented kind of set of circumstances where it was a perfect storm, right? We weren't prepared for it. So it was quite shocking to go from, thinking that 2019 was a perfectly normal year, 2020 rolls around and now everything is shut down and my life is nothing like it was, several months ago. So it's that shock that kind of puts us into, a very negative mind space. And I think that has happened for a lot of us is how do I cope with these new life circumstances? How do I cope with this crisis? And what is happening is people are feeling overloaded, right? I don't have a break from this. I can't take a break from the pandemic, can I? It is a reality that we live in. So I think that's kind of one of the reasons why it's kind of affected us mentally at such a deep level.
Dr. Nishreen?
Multiple factors causing this, and I think two key factors are contributing massively to mental health concerns during the pandemic. One of them is, as humans, we like to be in control. We like predictability and we like to know what is going to happen. And therefore, this sudden, unprecedented sense of control being snatched out of all of us is causing a lot of mental health problems, across the spectrum, across populations. Even young children are not able to process this loss of control and predictability in their routines, and they don't know when this will end and what's going to happen. The second one, which is very obvious, is the amount of grief and loss associated with the pandemic. As the the second wave has sort of come, at least in India, the amount of loss associated with it, the amount of grief, the amount of sharing that's happened on social media has a direct impact on mental health. And I think that has been one of the hugest contributors. There hasn't ever been a period of time where there is so much negative information, news, loss, grief, all packed into such a short period of time. It is but obvious that the human mind will have a reaction, a rebel to that. And therefore, I think we're seeing, along with a lot of the reasons she also elaborated earlier, we're seeing this kind of a reaction to the pandemic emotionally and mentally.
So, Dr. Nishreen, who's at most mental health risk during this pandemic? Who, in your opinion, would be the ones who are at most risk?
Yeah. So, Dr. Madhur, I'd just like to probably use an analogy. It's about how thick your raincoat is when you're out in the heavy rain. So, there are certain populations who are a lot more at risk than others. And it's completely my personal opinion. There is no research to back me up, but I think it is the youngest and the oldest populations, the young children and the geriatric population who are most at risk during this pandemic. Primarily because a lot of the tools and techniques available to them in a so-called normal period of time is now not available to them. The amount of dependency that both of these populations the amount of dependence these two populations have on others because of the circumstances right now is putting them a lot more at risk. So children aren't able to leave the homes, children aren't able to meet friends, children aren't able to process what is going on, the restriction of activity, sports. I mean, the plethora of reasons why this population is at risk. And with the elderly, a lot of our lives right now are online. They are digitized. They are completely based on technology. And this population is completely at loss due to it. So the amount of people who are getting impacted, I think, massively lies in these two areas. If Dr. Yamini has something more to add, it would be interesting from the Western perspective.
Sure. So I definitely agree. Children and elderly are quite vulnerable. But we could also think of people who've had a history of depression or anxiety, and now the stress of the pandemic kind of sets it off. Also, if you have a family history of depression and anxiety too, it puts you more at a risk, because there is a model in psychology where if you already have a risk of developing depression or anxiety, a very stressful situation like a lockdown, a pandemic, a loss, grief can set off or trigger, those symptoms that you are vulnerable to developing, right? So those could also be individuals who are at a risk of developing mental health issues.
Dr. Yamini, can you just tell us a little bit about the effects of COVID-19 and post-COVID-19 on mental health?
I think we've covered a lot of the mental health aspects. I kind of want to go back to what Dr. Nishreen mentioned about a lack of control. I think that's a really major issue, because we know it's going to end, right? But we don't know when. And humans are creatures of habit, and we want to control things around us. So this creates a sense of helplessness, right? And helplessness kind of feeds into hopelessness, where you feel that it's nothing is worth it anymore. I just want to give up at this point, because I'm tired of fighting to continue living in this lockdown pandemic world. So I think it's kind of a combination of that, a lack of control, hopelessness, helplessness, that's really triggering mental health issues. So when you feel that sense of helplessness come in, I encourage to ask yourself, so right now, what do I have under my control? What is in my hands? What can I change? I can't change the government. I can't increase the number of vaccines. I can't, change the behavior of the people that are around me, right? But what do I have control over right now? Is myself, my physical health, my mental health. How do I create opportunities for joy? How do I develop my own relationships, right? So when you feel out of control, take a moment, and I usually ask people to write it down. So what is in my control? What is not in my control? I'm going to focus on the list of things that I can change and control, right? Because it's not really worth catastrophizing or focusing on things that I have no power over. That's just going to cause more frustration, anger, anxiety, and helplessness.
Dr. Nishreen?
I would just like to add, just like there are some negative impacts of COVID-19 which are going to last, there are also going to be some amazing positive impacts of the pandemic and this conversation around COVID-19. Never ever has there been this much momentum in talking about mental health, about seeking help, about naming the elephant in the room. What we have been able to achieve in the last 2 decades, again, power packed, we've made it happen during the pandemic. So I think the good part about this is going to be how much people are going to acknowledge mental health, side by side with their physical health, just the way it is the body, it is the mind, just the way there is a, general practitioner, there is a family counselor or a psychiatrist. So I think it's a great equalizer of sorts, and the effects of the COVID-19 are here to stay both positively and negatively. On the flip side, of course, it has been recognized that every time there is, health crisis, and especially taking an example of how when the Ebola outbreak had happened, the year after or 2 years after, there were a lot of increases in PTSD cases that were seen. We do hear a lot from clients who or patients who have had COVID, who've been in hospitals, who've been in ICUs, them and their family members going through severe and traumatic stress experiences with struggling for medication, struggling for beds. We know the entire sort of a story. And so this is one of the things we're going to have to watch out for as one of the long-term effects of the pandemic, even after it has passed, which I hope is soon.
Right. Nishreen, you mentioned post-traumatic stress disorder. Can you just tell us a little bit about it so that people understand that better?
Yeah. Very simply put, it is just like you have stress to a situation. Here, there is a compounded stress reaction to a situation. And that situation is usually something that was fairly traumatic for you. Now, trauma can be defined as something that's traumatic for the individual, not necessarily a universal experience. Yeah. So PTSD, breaking down, post-traumatic stress disorder, post an experience that you've been through, which was very traumatic for you personally, caused you a lot of stress, turns into a reaction which you aren't able to cope up with normally or naturally. It tends to have reverberating effects over a longer period of time. Usual symptoms are having images continuously running through your head of that experience, having a stress reaction, having panic, feeling helpless, hopeless that the situation may come up again. In some patients, there usually is also a mood component. They start feeling depressed. They start feeling like there are rapid mood changes. So it is different from person to person, but overall, this is what the clinical scenario looks like in PTSD. It is very treatable, very manageable. There is a lot of awareness now about PTSD, and a lot of brief therapy programs are available for the condition. So nothing to worry about, just a big name for a very regular response to something which has been very disturbing for an individual.
Dr. Yamini, did you want to say anything else about PTSD?
I think it's been covered, Mom, pretty well.
Thank you. Dr. Nishreen, would you be able to talk to us about the importance of rational thinking? How does it improve mood? And can you elaborate on some steps towards that?
Sure. So every counselor and every psychologist has a different approach to working with their clients. And me being a rational emotive behavior therapist, cognitive therapist, dialectical behavior therapist, whatever you may call it, there is a huge emphasis when I work with my patients or my clients on being a rational thinker. Now, the basic understanding underlying this is when you have an emotional reaction, which is rather extreme, be it sadness, be it anger, be it fear. The basis of that reaction is actually an irrational thought or belief. So helping the person in front of you decode that style of thinking and untangling the irrational beliefs to be a little bit more rational also reduces the intensity of the emotion that they're feeling. So if I'm feeling rage on, say, a 9 or a 10 out of 10, if I were to simply be able to reframe the way I think slightly, what can happen is my 9 out of 10 or a 10 out of 10 of rage can reduce to irritation or a milder version of anger and become a 4 out of 5 out of 10 very, very easily. Now, to explain that, I'd just like to break it down into small steps, right? What we tend to do when you're trying to be a rational thinker, and we can share this information, it's also very freely available on the web. What you need to do is you need to follow a simple A, B, C, D, E model, okay? A stands for your activating event, something that upset you, something that gave you an emotional reaction is defined as your trigger. B is the thought that you had. C is the way you felt. D is the way you will dispute your irrational thoughts. And E is how you feel after. So it's really a very simple sequence of events. The only difference being that we focus a lot on the irrational beliefs that lie at the basis at the B. Okay, and then we move to D where there's a lot of disputation happening. I'll give you a very simple example. Okay, so you read some news in the media about COVID, and it triggers fear, it triggers a feeling of being upset. So the activating event here is reading the information, the consequence of it being fear, right? What we do at B is we try to identify some base thought, and when you reflect, you will find that there is some core belief behind this reaction of fear that you felt when you read that news article. For example, this is a hopeless situation. I'm never going to get out of it alive. Okay. Usually thoughts like these happen very automatically in our head without us reflecting on them. What rational thinkers do is they start reflecting on what those core beliefs are. You then move to the step of disputation, which means you simply ask yourself 4 questions. The first one being, what is the worst that's going to happen? The second question being, do I really have any scientific data to back up my belief? The third question is this way of thinking really helping me or hurting me? And the fourth step is, what can I do about it? Right? Now, without going into much detail, most often when you run through these 4 steps of disputation, you will recognize that a lot of your thoughts are not even backed by data. For example, this pandemic is never going to pass. I'm never going to come out of it alive, right? The fact is that history has seen enough pandemics to know that this too shall pass. 2, the fact there is no predictability on the future. There's a 50-50 chance that you may be alive or you may not be alive. There's no way of predicting absolutely that you will not make it out alive. So simply running yourself through some steps of the disputation in rational thinking tends to help us become a lot more logical and rational in our thinking. And very often you will find that irrational beliefs don't serve us. They don't help us. We keep thinking them to a level of self-sabotage. And so dropping that from your way of thinking makes a huge difference. So sorry, I may have just gone a little bit in detail, but a lot of help is available online. And one of the resources we will be sharing with the audience later does help you with apps which make you think more rationally. Picking up steps from the internet on rational emotive behavior therapy is a very, very useful technique. And I have worked with a lot of patients who have said it has helped them become more rational thinkers, as a result of which they have better emotional health. And there's a lot of evidence showing how CBT, REBT helps people recover from depression, from anxiety disorders.
Thank you, Dr. Yamini. Anything else you'd like to add?
I think Dr. Nishreen really explained it very well. I would like to say that there's kind of a mantra that I share with my clients. That thoughts are not facts, right? So you might think that something's going to happen, but that doesn't mean it's a fact, right? It doesn't mean it is going to happen. And I also encourage people to use a paper and pencil or paper and pen when they are disputing or challenging the thoughts, because that's easier, right? And then eventually people learn how to challenge pretty automatically. But it's very important to take a step back and reevaluate your thoughts, because sometimes your thoughts or your belief system is like wearing sunglasses, right? If I'm wearing blue sunglasses, my world looks blue to me, right? But does it mean the world is actually blue? No, right? So it kind of helps you, this ABCDE process kind of helps you have more realistic and rational thoughts, and then you're not wasting as much energy, resources, or your emotional effort into worrying about something that is very less likely to happen, right? In another thought, we call them mind traps. So one mind trap is catastrophizing, which is thinking the worst is going to happen. And sometimes thinking the worst kind of gives people a false sense of control, right? If I think this worst thing is going to happen, at least I can be prepared for it. But then if it's not going to happen, then, why are you kind of running around in circles trying to solve something that's not going to happen? So essentially, all of these apps or even very simple journaling techniques can be really helpful in rational thinking.
Thank you. Dr. Nishreen, can you just tell us how the TIP skill can reduce fear and anxiety? And can you just elaborate on what the TIP skill is?
Yes. The TIP skill is a very useful technique from dialectical behavior therapy, which was introduced by Masha Linehan, who's an American psychologist. And I find it such a good tool to take away. Usually, most conversations around mental health focus a lot on theory and less on skills and techniques. And one of the conscious efforts I think Dr. Yamini and me have made today is to talk a lot more about tips and tools and techniques. And ironically, the TIP skill is one of them. Now, if you break TIP up into an acronym, it stands for TIPP. T stands for tipping your body chemistry. I stands for intense exercise, P stands for paced breathing, and the next P, it's a TIPP, the next P stands for paired muscle relaxation. Now, this is a very useful technique which all of us can use every time we feel any kind of upset. It doesn't have to be a mental health disorder upset. It could be simple emotions like feeling angry, feeling anxious, feeling scared, feeling worried, feeling disturbed, any of these emotions which are slightly above our window of tolerance. Now, what you need to do in the tip skill is crunch the TIPP into a very short period of about 5 to 7 minutes. So you need to achieve all the 4 steps in the 5-minute time frame. What we're doing in the tip skill is we're playing a game with our minds. What we're doing is my primal brain or my emotional brain is feeling this fear, anger, anxiety. But my, logical brain or my brain, which is looking after my physiological, experiences, for example, my heart rate, for example, my muscle tension, my skin conductivity, is not necessarily at its best. So we play a small little game with our body and our mind to distract from the emotion that we are feeling. So what you need to do in tea is you need to tip your body chemistry. So if it's really hot outside, you suddenly get a chill, right? You freeze. You can do this by splashing really cold water on your face, by taking ice cubes ideally and rubbing them on your chin and your cheeks. Or you can, if it's very cold, you do something with a warm shower, etc. You immediately follow that with I, which means you simply need to increase your heart rate. So this could be achieved by doing 2 or 3 Surya Namaskars really quickly, doing a few sit-ups and crunches, star jumps, just something to get your heart rate changing from what its base level is. You then follow that immediately with P, which is a paced breathing. Now, the paced breathing could be any form of breathing which is different from how you're breathing right now. So breathing in, holding your breath, breathing out, and repeating that about 5 times to 7 times. And follow that immediately with paired muscle relaxation. And this is what it looks like. You simply tense your entire body, crunch it, tense it, and you release. And once more, you tense it, crunch it, tighten it, and you release. So you're doing your TIPP in very quick succession in 5 to 7 minutes. As a result of which, the brain is confused. Do I focus on the emotion? Do I focus on getting my, biorhythm correct? Do I get focus on the heart rate, the breathing, the muscle tension, skin conductivity, etc.? And this has been shown to be very, very useful in patients who are having panic, anxiety, can't control their anger, children who are very emotional, can't handle a tantrum, but are made to do tip, very quickly forget that they were even having that tantrum. So it's a useful technique used across populations.
Thank you very much, Dr. Nishreen. Nishreen, can you also tell us about mindfulness and its uses in maintaining good mental health?
Yes. So earlier, what was known as meditation and meditative techniques, which requires you to sit still for fairly long periods of time, keeping all thoughts at bay, has had a lot of resistance, clearly, right, from mental health professionals themselves, because most of us aren't able to meditate very successfully and therefore can't preach that practice. So what has then evolved as a version of meditation, but very effective, very easy for most of us to do, is mindfulness. And it draws a lot from the Eastern, techniques of meditation, but has been broken down into layman terms. Mindfulness simply means being in the present moment. And a lot of our mental health signs and symptoms prevent us from doing that. We're either worried about the past, or regretting the past, or concerned about the past, so we are wasting a lot of our time and energy on the future. So constantly being able to have the power and the practice to be able to be in the present moment tends to help relieve a lot of the signs and the symptoms that we may be having due to mental health conditions. Now, in mindfulness, there are several ways and methods of practicing it. You could practice mindfulness by participating, that means dancing, playing a musical instrument, movement, yoga. You could do it through observation, that means you simply watch the ocean and the waves kind of roll back and forth, back and forth. You could also do it through description. That means you are basically describing what you're feeling, what sensations run through your body. There are multiple forms of mindfulness. What I find very effective, and one of the methods I would really like to work with the audience here right now in this session itself, is a mindfulness practice which uses your five senses. Very simply put, what you see, what you hear, what you smell, what you taste, and what you touch. So with the panelists' permission, if I could just take the audience through it in the next couple of minutes, if that's okay.
Yes, please go ahead. Thank you.
Yes? All right. You simply need to be sitting very comfortably. Okay. In the first part of this exercise, we'll be keeping our eyes open and we will be picking any object in front of you and fixing your gaze on that object. Once you fix your gaze on that object, I would like you to not look away from it, but simply start observing it. Look at its color, shape, size. Start observing details about this object which you weren't aware of till I asked you to start looking for details. Smaller and smaller details. As you keep observing and keeping your gaze on this object, you become more aware of what you see. Gently closing your eyes now, I would like you to focus on the sense of listening. As you hear my voice, I would like you to observe what my voice sounds like, the pace, the volume, the pitch, the tone, the quality of what you hear from me. In a moment, I'm going to be quiet and I'd like you to focus on what you can hear from your surroundings. Wonderful. Moving on to our next sense, the sense of smell. In the next few breaths, as you inhale and you exhale, I would like you to focus on what your sense of smell is able to focus on. It could be some scents, aromas, fragrances that are in your environment right now. It could simply be the humidity in the air. It could be the smell of your perfume, your clothes. But try to pick up as much information as you can, simply focusing on the sense of smell. Gently moving on, we will focus on our sense of taste. Lightly moving your tongue around your teeth, your gums, your jaw. I'd like you to focus on what you're able to taste. Is the environment of your mouth warm, cool? Are you able to identify some flavors from the last beverage or food you consumed? What does your sense of taste tell you? And lastly, focusing on the sense of touch. I'd like you to touch any surface with the tips of your fingers and start gently moving your fingertips around it. It could be the upholstery, the table surface, your clothes. Try to observe what you're able to feel. Is it soft, smooth, rough, cool, warm? Similarly, moving your toes, try to observe what you're able to touch with the bottoms of your feet. For the next 2 breaths, simply inhale and exhale. Inhale and exhale. And gently open your eyes to be present in the here and now. This small exercise, Dr. Madhur, using our 5 senses, is one of the simplest techniques to bring us back into the present moment. And you will find that your mind clears up a little bit more than it was before you started doing this exercise. And it's a great way to center, it's a great way to bring about a shift of emotion. And mindfulness does work. As long as it's done non-judgmentally, it is done effectively, it is done, with one-mindedness. With practice, it does become a very important tool and technique to have in our box, like Dr. Yamini said, in our box of tools that are available with us.
Thank you very much for that. That was really interesting. Can I just quickly ask, how often would you do that? I mean, that exercise, would you do it a couple of times, or would it be at times when you're probably stressed and just want to get your mind off that situation?
I think that's a very important question, Dr. Madhur, because most of the times we recall what we're supposed to do only in times of crisis. And when you do it in times of crisis, it usually doesn't work as effectively, which then leads us to believe that these techniques don't work because it didn't bring about such a rapid change as fast, as quickly in the intensity that I wanted. So if you are trying to really pick up on tools and techniques around mental health, it's very important to practice them regularly with a routine. And ideally, mindfulness should be practiced at least 2 to 3 times a day, say breaking it into your morning, your afternoons, and your late evenings, till you really get a grasp. It's a sort of a habit formation. It's a classical conditioning. Once your mind is used to these tools and techniques, then when you utilize them during periods of crisis or nervousness or anxiety or anger, they are most likely to be most effective during those times.
Thank you for that. In my case, being mindful of the time, I'm just been prompted that we may have exceeded our time limit, but I believe you wanted to share those resources with us. So I don't know if that's possible for us to do it now. And show it to the audience in terms of who they can contact here in India. And also, I think there is one for the USA as well. So if we want to just hold on to that for a bit so people can make a note of that when they want, I think it's very important. We've got questions that we have received from our members as well, but I'm not quite sure whether I'm going to be able to ask those questions. So I just want to check with Krishan and Mom, whether I can still go ahead and ask those questions, or we've finished the allocated time and we'll have to wind up. Aditya, anybody who can just help me out with that?
Yeah, Madhur Ma'am, maybe one or two, in the interest of time, we could take 1 or 2 questions which you feel are relevant and not covered as part of whatever our experts have shared.
Okay, sure. So I'll just quickly go through them and we'll try and see if we can. We've received quite a few of them. I'll just start with obviously the first one that came. Can I go ahead? Looking at death and destruction all around, I'm feeling helpless. My husband and I are post-COVID stage, and I constantly worry about my husband's health and longevity. How do I deal with this? Can we start? Dr. Yamini, would you like to just help us with that question?
Sure. Firstly, what we're experiencing now is health anxiety, right? So we're worried about, our health. We're worried about someone else's, our loved ones. We're afraid of their, we're afraid of losing them. We're afraid that something's going to happen to them. And a lot of times this is a result of traumatic experiences, right? Given that the question says that they're in a post-COVID state, so they've already been through COVID before, right? And like Dr. Nishreen mentioned, going through, a sickness, illness, being in hospital, all of these things can be pretty traumatic, not only for the person who experiences it, but also. I'm sorry. So a person who experiences it, but also a person who witnesses it. So what can we do about our health anxiety? I think I'm going to connect back to Dr. Nishreen's overview of the ABCDE model. So being more aware of the thoughts about the what ifs, right? So what if this happens? What if that happens? So again, those are all thoughts. Those are not facts. So find a moment to challenge those thoughts and identify more realistic or rational ways of reframing or experiencing the situation. Focus on the present, because if you're worrying about their future, you're missing out on spending time with them in the present, right? So focus on being present with them and connecting with this person. That also helps with reducing health related anxiety. Engaging in some deep breathing activities, some mindfulness meditation like activities can also help you feel more centered and in control of what is happening. But essentially, the need right now is to take care of yourself and also to be more aware of your thoughts and then challenge them a little bit.
Sure, thank you very much. I must apologize to those of you who have sent us the questions. I'm afraid it's not been possible for us to cover all of them because, in a sense, this has been an excellent session which has covered a lot of ground in terms of what we have seen during the COVID pandemic. So I'd just like to personally thank both of you for taking time to speak to us on this session. And I'd like to hand over now to Aditya, who I think would like to say something, and probably Krishnanand Ma'am, if you'd like to wind up.
I think Mohit wanted to say something, but I would like to propose hearty thanks from all of us, for both of you who have taken part in this, for Yamini who has taken time out, and Nishreen, of course, from her schedule. Even today being a Sunday, I'm sure she's quite booked with her calls and consultancy. Thank you, both of you, for answering so well. And we've been exchanging notes on the WhatsApp saying that this answers a lot of questions which people would have to ask. And it was really effective. Thank you very much. Thanks also to Madhur. Madhur, you've been really great passing the questions on and responding and sort of keeping the show alive. And it's really nice having you on this panel. I would also like to thank the Sayujam committee for organizing this show. The back-end support and everything was phenomenal. And I think once my Wi-Fi went dead, and that's why I could not join again, but I've rejoined. And I would like to thank, of course, our Param Pujya Swamiji for giving us this opportunity to hold these programs, and the MUT management, the website committee, and everyone involved. I won't take names because there are a lot of people. Thank you very much, and I hope we will see you more often. And I wish we could have another program with you again. Thank you. Thank you.
Thank you very much, everybody.
Would Mohit like to come on?
Yes. So thank you very much to all the panelists once again, and especially finally to the audience as well for listening on. So with that, I would like to end with the Sabha Samapti Prarthana. Om Nandantu Sadhaka Sarve Vinashyantu Vidushakaha Avastha Shambhavi Mestu Prasannostu Guru Sada Sarve Bhavantu Sukhinaha Sarve Santu Niramayaha Sarve Bhadrani Pashyantu Ma Kaschid Dukkham Apnuyat. Om Shanti Shanti Shanti. Om Namah Parvati Pataye Har Har Mahadev.